thanks so much for joining us on the podcast. I really appreciate it.
I'm very happy to be here.
Great. Thank you so much. So I'd like to start with, because I'd like to go through your full journey of becoming a doctor and to kind of where you are now with your practice. One of the things that you have said, actually, there were a couple of things, but medicine should also view you as a whole, fully integrated, multidimensional being and make good use of the best concepts and treatments from all valid medical traditions. And the reason out of everything that I've read of yours so far that really struck me is, along with a lot of people that listen to this podcast, I have a chronic illness that no one seems to be able to fix. And I understand when people come in and they look at your symptoms and that's how they want to let's just fix this thing right here. You were one of the first doctors that I've ever heard actually say, no, it's holistic. It's really holistic. Let's tackle it from a different perspective. So talk to me a little bit about how you came to that way of thinking and working in your practice.
Okay, well, that's an interesting question. I remember starting to want to be a doctor when I was in 6th grade.
Oh, wow.
And then it turns out when I got into junior high, I started taking science classes that I enjoyed it. I really liked science and the way of thinking. And so as an undergraduate, I really thought it was important to teach myself how to problem solve and how to really think. And so, I really liked engineering, it turns out, because engineering basically is problem solving.
Sure.
And so I have an undergraduate degree in material science and engineering. And back then we were working on like the Jarvik heart and artificial blood vessels, artificial tendons. And I was kind of working on how to make these things more biocompatible. That was my undergraduate research.
Wow.
And but I was also able to double major in chemistry at the time because so many of the classes overlapped. And then I have a minor in physics. So pretty science oriented.
Yeah.
Undergraduate. But luckily my summer job was, I was a whitewater river guide on the Green and the Colorado rivers. And so I spent the summers basically taking people down through these incredibly beautiful canyons and sitting around the campfire at night, talking with them. And we got into philosophy and I really started getting interested in humans and how they worked, which I think is helpful if you're going to be a doctor, right?
Right.
And but I was also not just interested in the like the content of science. I was very interested in the process of science.
Okay.
How do we actually know that what we think we know is true?
Okay.
And it turns out that's a difficult question to answer. And philosophers have been working on that for over 300 years. So one of the important parts of science, a very important aspect of science, is the data. And the data is pretty much primary. And then the models are basically designed to try to explain the data.
Okay.
And so one of the most unscientific things a scientist can do is discard data just because it doesn't fit the model, the current model.
Okay.
So once I realized that, hey, everything in your life exerts some kind of influence on your health, right? Everything.
Right. Which is something else that you said, which was amazing, which was try to think of one thing in your life that has absolutely no influence upon your health.
Yeah, good luck.
And I'll tell you, when I read your book, I'm not kidding you. I paused. I thought, I can do this. Yeah, I still haven't come up with an answer yet.
Right. I mean, even the boulder sitting out in the field is leaching minerals into the soil that's feeding the plants, that's making the oxygen that you're breathing. I mean, we're all interconnected on this planet.
Absolutely.
And so it just made sense to me that we would have a system of medicine that can take your entire life into account. And when I looked at the medical model that I was being taught in medical school and realized this doesn't account for quite a lot of human experience, the medical model basically sees you as a skin bag of biochemical reactions.
Mm-hmm.
And the assumption is if we just knew what those biochemical reactions were, then we could pour in other chemicals and you could be the person you wanted to
You
be.
could control them. Yep.
Mm-hmm. You can control it. Well, right there, that violates the Heisenberg uncertainty principle because you can never know the initial conditions exactly.
Right.
And
Right.
it's astonishing how, like, you know, the quantum worldview and Eastern traditional worldviews are alike in so many points.
Mm-hmm. Mm-hmm.
And it's been a big curiosity over the years, like how could this quantum explanation that only work, it's only really needed on very, very small scales like atoms and electrons and things. But yet it applies to us as humans and we're big. So
right.
But so anyway, I was wanted to be a family practitioner because I kind of like being a jack of all trades.
Okay.
And
Makes
I like
sense.
being able to see a person as a whole person and be able to take their whole life into account. So I was, I didn't think all these things at once. Obviously, this is an
Obviously,
evolution.
yeah.
But I
Right.
remember a day when I was third year resident. So I was in my 7th year of medical training. And I just finished my afternoon in the clinic. And I was walking back to the residence room to dictate my notes. And I was just thinking about the patients I'd seen that afternoon and asked myself the question, well, what prompted them to actually, pick up the phone, make an appointment and come in? What are they really looking for? And I thought about, the person with hypertension and the person with diabetes. And then I thought, well, what if they're really looking for healing? And I stopped in my tracks because here I was in my 7th year of medical training and I didn't know what healing was.
Like, I know. That still, that boggles me. Yeah.
Yeah. And because for one thing, medicine likes to be a scientific endeavor, right? And in science, we always define our terms so we have a precise language so that we all know what we're talking about when we talk to each other.
Which makes sense.
Yeah. So how could there be this multi-billion-dollar science-based healthcare industry with no concept of health?
No true definition. Right.
No true definition. So I thought, well, I got to remediate that problem. So I started searching for a definition of health or healing. And 7 years later, I started to get an appreciation for why nobody did it.
Nobody's had one. Right.
Yeah. So, but what I noticed in that time was that even though I didn't have a precise definition, and I'd gone through several by that time, there were like one, there was back in that day, there's an organization called the American Holistic Medical Association. And their definition of healing was balance and harmony with the cosmos. And I thought, well, that sounds pretty good, but how do you do that in the exam room?
Yeah. I mean, that's kind of
like, okay, Mrs. Smith, today we're going to put you in balance and harmony with the cosmos. But what I realized later, yeah, exactly. And what I realized later is, no, that's actually the effect of healing. That's not what healing is. That's a result of healing, that you come into that balance.
Right. So, and as we're going, I want to make sure people know that because we're getting to the point that I can already tell I'm going to start referencing this. This is your book. I'll have it on the website as well as in the notes from our podcast, The 7 Tools of Healing, because I know we're going to be referencing this quite a bit as we go. And I want people to be able to, what did they say? Where did they say? Let me go pull that in.
Yeah. So very quickly, I know we need to keep going, is that even though I didn't have a definition of healing, I could kind of recognize it when one of my patients experienced
when you saw it.
Yeah. And so I asked myself the question, okay, so by that time I knew healing was more than just how your physical body functioned. Obviously you needed mental health too, and you needed healthy relationships and all kinds of things, right? Healthy sleep, that all kinds of things. So I got to thinking, well, so if somebody has symptoms, that's a clue that they need healing. And the resolution of the symptoms is a clue the healing has happened. It's not the actual healing itself. So the symptom's a
Mhm.
clue, and when the symptom goes away, that's a clue that it has happened. So I started looking at my patient. Well, what else happened to them then besides the resolution of their symptoms?
Mhm.
And what I saw was that they had learned something. And what they had learned almost inevitably had deepened their understanding of themselves. It had given them a deeper perspective of who they were, and it helped them be more in their power and along those lines, right?
Mhm.
And so I asked myself the question, well, what if that learning about who they are is the actual healing? And again, that might just be a side effect of the healing. But what that did was that got me focusing on, well, I want to, when I'm treating a person, I want the net result to be that they also deepen their understanding of themselves, not just have the symptom go away.
Right.
And so I
Okay.
started looking for therapies that both, helped a person find the imbalance that's being expressed as a symptom and correcting the imbalance, but at the same time, learning about themselves. So that's basically what I've been trying to do for the last 37, 38 years now at this point.
And would it be wrong to classify it as, and again, this is, my takeaway, having read this, it's you're treating the person is
Right.
what you do, not the something you're actually treating the person.
Yeah. I mean, medicine has a lot of really powerful tools
Mm-hmm.
that they're very handy. And so we do use them to treat symptoms when necessary, but I don't generally just stop there. I'll say, okay, you have, your blood pressure is high. We can give you medicine to lower your blood pressure, but your high blood pressure is not the cause of your high blood pressure.
Right. Let's dig deeper and figure
Let's
out
dig
what's causing
deeper.
it. Mm-hmm.
Your high blood sugar is not the cause of your high blood sugar, or whatever, right?
Mm-hmm.
So your arthritis isn't the cause, So basically, almost anything that somebody comes in with, there's something causing it,
Mm-hmm.
and in my mind, so like for example, a chronic disease is basically chronic because it resists our attempts to treat it and make it go away,
Mm-hmm.
right?
Right.
And if the NIH, the National Institute of Health, does these surveys every once in a while, and the percentage of Americans living with chronic disease is just going up and up and up.
Yes. Yeah, it's
And
staggering.
it's like, I think it was 54% last
Mm-hmm.
study I saw, and half of those folks are living with more than one chronic disease at a time.
Right.
So this progression is happening on conventional medicine's watch.
Mm-hmm.
So it turns out conventional medicine is great if you need your appendix out or something,
Right. Right.
but it's not very good at dealing with these chronic diseases. And so the thing that's helped more of my patients more than anything I've learned in medical school is this ability to help them listen to, okay, what is my body trying to say by generating this constellation of symptoms?
Mm-hmm.
And can I really find the real imbalance and get that imbalance aligned, get it corrected?
Get it back in check.
And over the years, I kept trying to, peeling down through the layers, thinking, oh, this is the root, this is the root. And every time I would think this is the root, then I'd find, no, there's something behind that too. And then the person would come in with something else, and we find that something behind that too. And so luckily, I've had a pretty stable practice. I've been able to follow. I've got some patients I've been seeing for over 20 years. And so I've really been able to see their life evolve.
Right.
And, a lot of doctors, I think, can't see these patterns because they don't see the same person very often. Because doctors move around, people's insurance change, they have to change doctors.
Mm-hmm. Or if
And
you're chronic, you just get tired. You get tired of going.
go somewhere else. Yeah.
You just get
And
tired in general. Yeah.
so but being able to see these, follow these people for long term, and has helped me really keep peeling back through the layers until we got to the roots. And I know this might sound a little outrageous, but the root of almost everything, in my opinion now, after watching all this, is actually how consciousness is getting expressed.
Really? So what do you mean about that? How do you
Well,
mean?
I think that there's a consciousness behind all of creation.
Mm-hmm.
Okay. And you might call that God, you might call it Purusha, or, Brahman,
Right.
Wankantanka. I mean, there's lots of names for it, right?
Right.
So you might, and everything in the physical manifestation, like this clip here, or this
Mm-hmm.
microphone, or this computer, they're all expressing aspects of that consciousness,
Mm-hmm.
including your disease processes. And so there's basically, I mean, the consciousness that we have access to is essentially unlimited. But how many people do you know are living an infinite life?
Right. Right.
Right. And
Right.
so something's limiting our access to that consciousness, and something's determining what aspects that consciousness kind of come through and become our life. And so I call those determinants of conscious expression.
Mm-hmm.
And there's lots of them, like your genetics are determinant of consciousness expression, right?
Sure. Sure.
And but the determinants that we have the most say over, that we can actually maybe control, are your beliefs.
Mm-hmm.
So your beliefs basically determine what becomes your life. And that's why Goethe said, man is as he believes so he is.
Right.
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 And Henry Ford said, if you think you can, you can. If you think you can't, you're right.
You're right. Mm-hmm. Exactly. One
So
of
there's
my
all
favorite
these sayings.
quotes.
Yeah, all these quotes and sayings about how important beliefs are, right?
Mm-hmm.
And so I would say, I mean, not always, but majority of the limiting beliefs that are holding people back in their lives and creating these imbalances are generally belief imbalances, where they're holding some kind of belief that says they're smaller than they really are.
Right. Right.
And the
Which
symptom is, go
Oh,
ahead.
no, go ahead. I was just going to say, I mean, think about how many of us go through our everyday lives like that.
Oh,
And
exactly.
and you just don't think about it. It's somewhere along the lines you decided you couldn't do something, or you weren't as good as somebody for that, or you could only go this far, and it's stuck.
Yeah. Yeah. And studies have shown that most of the major beliefs that make up our worldview are in place in our psyche by the time we're 7 years old.
Mm.
And so how many of those beliefs are we going to consciously know about?
Right. Right. You just carry them with you.
Yeah. And so they're back here in the
Mm-hmm.
unconscious, sort of
And unconscious.
working away.
Mhm.
And all we see are the results feeding out, which we interpret as reality.
Right. And so the practice, the way that you come at things, you call it it's integral medicine methodologies.
Right.
Right. And one of the things that I know that you practice is it's cranial sacred, but it's actually mentioned at some point in the book as cranial osteopathy. Am I slaughtering that?
No, they're,
Okay, making sure I said it correcectly. So
yeah.
exactly what is this, and what is cranial sacral work, and how does this,
Well,
factor in?
so I did my residency in Saginaw, Michigan.
Mm-hmm.
So I was
Hey,
just up the
just
state
a little
from
bit up.
Detroit.
Yep. Yeah,
Yep,
you're just
right
right
there.
there.
Exactly.
Yep.
Exactly. And it turns out that they're down in Flint,
Mm-hmm.
East Lansing. There's a medical school where osteopathy and MD share a medical school,
Okay.
and they even take classes together the first 2 years of their training. And so they offer a 40-hour basic manual medicine course twice a year, I think. And so I use some of my conference time in my residency to just go down there and take their course in basic manual medicine.
Okay.
And that taught me a whole different way to think about the body. And I like working with my hands. So I came back to residency and started applying the osteopathic manipulations and getting really good results. But I just had a very basic, rudimentary understanding of it. But I was able to diagnose things that I couldn't treat. So I went to the residency director and explained the situation, said, I took this class and now I can diagnose these things, but I can't treat them. Is it okay with you if I refer clinic patients to chiropractors?
Mm-hmm.
And this was back in the 70s, right? Late
Right.
70s, early 80s. And he said, well, you're liable for your referrals. So if you get to know them and trust them, I'll back you up on that. He was a great
Nice.
program
Yeah.
director. His name was
Yeah. No kidding.
Dr. Kelly. Yeah, very open-minded. And so I started calling, get out the phone book. This is before the internet. And got out the phone book and started calling chiropractors and say, hey, can I meet you for lunch? And you just hear their jaw hit the ground on the other side of the phone.
Right.
But that was my first foray out of, conventional medicine.
Mm-hmm.
But what I found was a whole group of practitioners who were highly trained and caring about their their patients, and knew, most of them knew what they were doing. And so I started referring people and seeing how it worked for them, and when it didn't work and when it did, and just learning that way. So that sort of set the stage. And then I did my first practice. I went to a small town in rural Maine and was the only doctor in a small town up there, about 2 hours north of Portland. And again, I took some time to go down to Boston, and I took a course in clinical hypnosis.
Mm-hmm.
And that taught me a whole different way of thinking about the mind.
I bet. Wow.
Because in residency, I was very interested in psychology too. So the residency actually had a psychologist on staff, and most of the residents ignored her all the time. So I had plenty of time to sit and chat
And
with her
doctor.
and
Yeah.
pick her brains.
Yeah.
Yeah. So I was really interested in that. And so I didn't learn cranial work till later, like 7 or 8 years later. I actually was 91. I started studying the cranial work, which is a subspecialty of osteopathy.
Okay.
But it's very gentle. There's no popping or cracking. And it turns out the body elaborates these 3 subtle rhythms. And you can palpate those rhythms with your hands. And when you can feel where they're stuck or asymmetrical or out of balance, and there's therapeutic techniques you learn to sort of encourage the rhythms back into balance.
Mm-hmm.
And then that frees up the body's own innate healing capacity.
So between the cranial work and then really doing,
well, what
sure
I
what else.
found, what I noticed was when I started doing cranial work on people, they would sort of automatically go into a hypnotic state.
Oh, wow.
So I didn't even have to do an induction or anything. And
Wow.
and so what I would do is I just ask people, okay, I'm listening to these rhythms while I'm working on you. I'm just asking you to listen to your body from your side. And then the way I learned to do hypnosis was very allopathic, where we were just taught all these post-hypnotic suggestions to leave people with. And again, it's very symptom oriented. It didn't get to the root, but there's another form of hypnosis kind of called Ericksonian hypnosis, where you literally can go into the unconscious mind, like on a safari, or I think of like a fact-finding mission,
Oh, wow. Okay.
And since the unconscious runs your body, by combining the body work, really allows a person to, it kind of raises a curtain between the conscious and the unconscious, and they can actually get really good information from their body and basically understand the body language the body is using. And so over time of doing this, and I noticed that everybody I worked with had this deep inner wisdom that was running their body. So you don't have to think about your potassium levels or your sodium levels or right. And your body just takes care of that stuff. And so people that were able to connect with that could ask, okay, well, what should I do to solve this problem in my life? What'll help me with my sleep? What'll help me with all these allergic reactions I'm getting now? Or what would help me with whatever problem, that my headaches or whatever, and then if they got really still and could listen, an answer
they would get the answer.
Yeah.
Wow.
Yeah. And over time, I noticed that there was a pattern to how this inner wisdom helped people. And that's what the 7 tools are.
Yep.
It's basically that pattern.
That
and
pattern.
And I had a whole string of patients that really couldn't listen to their inner, they couldn't connect with that inner knower part. And so I taught them the 7 tools, and they went home and practiced them. And after a few months of practicing them, they were then better able to connect with that inner knowing.
Do you think from your experience, pretty much everybody can get there, even though it takes a little time?
Yep. I think it's possible. I do believe there are certain worldviews that block it. And
Yeah.
as long as you're holding on to those worldviews, it's going to be challenging and maybe blocked. I
Might
mean,
hold you
for
back a
example,
little.
I've never seen anybody heal and remain a victim at the same time.
Hmm.
So
Yeah.
a victim mentality is it's a hard block.
Right. Right.
And what I say is, being victimized is a universal human experience.
Hmm.
We've all had things happen to us that we wish,
Sure.
right?
Right.
But being a victim is a way of seeing yourself,
Okay.
and that's what holds you back. So, and it doesn't say anything about all that you've experienced. That can be worked with.
Hmm.
Um, but the conclusion that you're powerless, you're a victim, then that's what you're
That's the one
gonna,
that impacts your body that you're carrying with you.
mhm. And
Wow.
that will become your determinant of conscious expression. And so you'll have experiences where you're powerless. Bad things happen.
Wow. So,
So,
and
and it's
this to
not that
me,
simple, obviously, but that's just an
obviously, yeah,
example. Yeah.
obviously, right. So, and to me, this is so fascinating. And I just have a myriad of questions, but I want to tie this a little bit into newborns if we could, because one of the things that we really advocate for with Children's Airway First is if we can get to these kids before the age of 6, you really could have this dramatic impact on their airway, which leads to their sleep quality and their health quality and all these things, throughout their life. And from my understanding, your cranial work is one of the things that, could be done to help some of these kids.
Yeah. So a couple of examples. So one of the things we see if a baby's tongue tied,
Mhm.
because babies suck when they're inside. They see it on ultrasound. Kids are sucking, right?
Mhm.
But if they're tongue tied, then they're sucking in an abnormal way, and they literally train their whole mouth and throat muscles to work in this abnormal way.
Mhm.
And so even after you release the tongue tie, they may still not know how to tongue thrust or, that sort of thing. And so what we found is if they have some cranial work right after the release, it often, again, frees up that natural balancing mechanism, and
Mm.
the babies start nursing a lot better. And
Wow.
so I really like to see babies. I mean, it might be good to even prep babies before, but I personally think the sooner you can do the release in a baby, the better. Not wait till they're a month old or 2 or 3 months old or whatever. Um, and then do 1 or 2 cranial visits to get them get their whole oropharyngeal area in balance.
Mhm.
Often helps them a lot.
And can this work
So
for older children as well? If you've got a child that's 4 or 5 and is a mouth breather or is having sleep issues, or how would you approach something like that?
yeah, if yeah, by that time they've already probably changed the growth of their mandible and changed their maxilla and all that sort of
Mhm.
thing. And so but what we found is that if children are going through orthodontics, for example, to expand the palate or
Mhm.
to move teeth around and stuff, that the cranial work helps orthodontics work a lot better.
Really?
Yeah. And like I had a patient as a teenager, one of her incisors came in behind the tooth that was supposed to be in front of.
Okay.
And so they were doing this treatment to literally move the tooth out and around and drop it back into place. And the orthodontist said, well, this is going to take 16 months to get this done. And she was in a lot of pain every time she went and had her braces adjusted. And so the mom set up appointments to have her come in to see me the next day afterwards. And after treatment and releasing tension patterns in the mouth and gums and alveolar bone and everything, she wouldn't have any more pain that month. And
Wow.
she got through the treatment in 10 months
Wow.
instead of 16 months.
Well, and do you
And
think part of that is eh, her body wasn't in pain, and so she was processing things different? Maybe is it possible that she was more open to the adjustments?
Well, and releasing the strain patterns each time allows things to just move better. And I also think it removes any forces that want to make the tooth go back to where it started from.
Hmm.
So nowadays they're asking people to wear their retainers their whole life.
Right.
And I think if they were to get cranial work as they went through that orthodontry, there wouldn't be any reason why their mouth would go back to where it
The
started.
resistance from their body would go away.
Exactly. I mean,
Wow.
I don't think there's any studies to prove that. That's just a theory that I
That
have.
theory. Right.
Yeah. But I've had a lot of patients. I could tell you lots of stories, but where the cranial work really dovetailed nicely with the orthodontia, and they get better outcomes more quickly with less pain.
That is amazing. Now, what about with sleep? Have you found, does cranial work assist people, especially kids, but anyone with sleep issues as well? Or would you approach, how would you approach it? Would you approach that completely different?
Well, what we can do with cranial work is just get your system into balance and then sort of step back and see what happens.
Okay.
And so it's different for each person. So, but you have a little bone right above your voice box. It's called your hyoid bone.
Yes.
And that hyoid doesn't touch any other bones.
Okay.
It's suspended in space by the force of three different muscle groups. So I
Mhm.
think of it like where the three legs of a Y come together.
Okay.
That's where the hyoid sits. And so the
Right.
bottom leg are these muscles that go from the hyoid down to your sternum or well, it's actually the manubrium there, and then your clavicle and stuff. And then the one leg of the Y are the muscles that make the floor of your mouth.
Mhm.
Because when you look at a skull, that's all open space there, right?
Mhm. Right.
And then so there's this floor of muscle, and then your tongue sits on that muscle. And then the back part of the Y are the muscles that go from the hyoid bone up to your there's these little, it's called the stylohyoid, little stylus that comes off the temporal bone. It looks like a let's see, what is it? The mites go up, the tights go down. So it's a like a stalactite hanging down from a cliff, a cave
Mhm.
wall, right?
Mhm. Right.
And there's a little muscle attached to that, and then they also attach to C1, the front
Right
side of
here.
C1, your first
Mhm.
cervical vertebrae. But those are the muscles that keep your trachea and your esophagus from falling down into your chest.
Mhm.
If you've ever wondered why your trachea doesn't fall down into your chest, now you know why.
Right. There
No.
you go.
But because it's a Y, all those forces play off each other.
The kind of push
And
pull.
yeah, and so if there's excess tension in the floor of the mouth, that will then can pull the neck out, for example, and that kind
Mm.
of thing. So getting this whole hyoid, I call it the hyoid complex, balanced, can really help the oropharyngeal muscles work properly.
Oh.
And and one of the things that affects airways is when your tongue falls back.
Right. Right. Which
Right.
is why retractive braces can be so dangerous.
Yeah, which is what I had actually. Now that I'm learning about all this stuff, it's like,
Right. Isn't this horrible? I did the
yeah,
same thing. I've
that's why
learned
I
about that
have
going,
no
why is this
chin.
happening?
Yeah. And but anyway, I was lucky I didn't get my braces on until I was 15. So I probably was already had a big enough airway. I didn't suffer from
That
it
it
too
was
much.
safe enough. Yeah.
But but no, I work a lot with this whole area to help people with snoring problems. With but I think it's very important in this process to make sure this whole mechanism, they call it the orthognathic system,
Mhm.
is balanced and working to its proper, uh, as best it can.
Right.
And I think cranial work, along with the training that they do, the can be really helpful in that,
Okay.
so that the training actually works and holds.
Right. So it doesn't regress, I guess is what
Exactly.
would be the right word. As far as pediatric medicine right now, where do you think we're missing the mark?
Well, from my experience, my observations in the office, I think most pediatricians are doing a really great job. And what I think would be helpful for these kids is if we had um, airway exam, tongue and oral and airway exam be a part of the newborn exam that the delivering doctor does in the delivery room.
Right. And I think people will be surprised to know it's not.
It's not.
It's
I've had
not.
I've had some kids 6 months old coming in and nobody's ever looked in their mouth. It's like,
Right.
okay. But I mean, they're
Yeah.
listening to their heart and lungs and they're checking their for hip
Hmm.
displacement. I mean,
But they're
there's
just
this,
not opening their mouths and really
and
looking in there,
yep,
moving their tongue.
sticking their finger in there, looking
Hmm.
around. Yeah. And it would just take a very short, just add a minute or two to the newborn exam, but
Hmm.
it could really change the baby's life if they could get the proper treatment started at that age.
Right. Because they could take a palate, for example, that was really high. They could actually adjust it while they're still malleable.
Mm-hmm.
Or, like you said, release a tongue tie so that they could nurse properly.
Mm-hmm. Yeah.
Yeah.
And again, so I work a lot with the mandible and with the temporomandibular joints and, the
Hmm.
masseter muscles, the temporalis muscles. People that clench their teeth in their sleep, it's
Hmm.
called bruxism. Um, bruxism is interesting because it's happening in your sleep.
Right.
So you have to get into that unconscious mind
To figure
in
out
order
why.
to make a difference in it. Yeah. So just getting a bite plate, then people just bite on the bite plate all night. And
Right.
it saves their teeth, but it messes
But
with
it's
their,
still happening.
yeah, it still
Yeah.
is compressing their whole cranial rhythm and still messing with the temporomandibular joint. So, so the thing I would like to see, and I know we're working with this as part of the Children's Airway First Foundation, is getting that to be an acceptable part of the newborn exam. And so, pediatricians, neonatologists, pediatricians that attend births, even the OBs, because sometimes the OBs are the one doing the new baby exam,
Right.
family practitioners, midwives, whoever's doing the initial new baby exam, just to have a airway check, oral, the mouth and airway check be part of that physical exam could make all the difference in the
It
world.
really could. It's fascinating. And again, as a mom of two, I had no idea. I
Yeah.
always assumed, they're going off, they're doing their thing, they're going to check my kid. We're great. And having, been a part of the foundation now for over a year and started to learn what goes on, it never occurred to me no one looked in their mouth. No one
Right.
checked.
And then also being trained to notice like when a baby's a mouth breather.
Yes.
That, I
Right.
mean, I never got trained to do that when I was in residency.
But you know what? The Navajo women never got trained. And I know you've probably studied this. They know to just come up and close their mouths. So we're back to that kind of inner consciousness somewhere along the way.
They figured it out. That's
They knew,
important.
just close them. And that's why they didn't have the issues.
Interesting. Yeah. So it'd be something simple like that. And even just a piece of that white micropore paper tape
Mm-hmm.
uh,
Mm-hmm.
really is a great way to
To
encourage nose
train.
breathing. Yeah.
Right. So,
So, but I personally think a good cranial evaluation early in life can help. There was a unpublished study that was done by an osteopath in Waterford, Maine,
mhm.
that there were two hospitals that did deliveries in his town, and every morning for 5 years he got up and went into one hospital and did just a 20-minute cranial treatment on all the babies that were born that day,
Yeah.
and then he didn't do them on the babies born in the other hospital as a control group. And then
Okay.
he followed those kids till they were 5 years old. And what he found was the kids that got the 20-minute cranial treatment on the first day of birth were hospitalized half as often as the other kids for
Wow.
all different causes,
Oh,
whether it was
yeah.
respiratory syncytial virus or whatever, hospitalized half as often. So talk about inexpensive preventative medicine.
Unbelievable. Yeah. No kidding.
Yeah.
Wow.
And he didn't get
So,
it. He wasn't able to publish it because he didn't like go through a institute review board or any, it wasn't a formal study or anything.
mm,
But I
wow.
met him when I was back in Maine. Pretty
Wow.
interesting.
That's incredibly interesting. So when we're talking about moms and newborns, you're talking to them specifically, um, what can they do to protect their newborns and guide them as they're growing older? Can could they actually ask for an airway evaluation at birth?
I think that would be helpful, and or do their own. I mean, moms can tell if their babies have a tongue tie.
Hmm.
Might not be able to assess a high palate. They might not know what that is.
Right.
But educate, moms can observe nasal or mouth breathing babies.
Mm-hmm.
So just a little bit of that education could happen in a prenatal class.
Mm.
This is what you
Right.
watch for in your newborn if they're a mouth breather. Just show
Right.
a few slides or something.
Mm-hmm.
That wouldn't be that hard to include that in the curriculum for prenatal classes, for
Mm-hmm.
example. So yeah, and the other thing is, parents and I think a little bit prejudiced, but especially moms, is really have this knowing about their kids.
Mm-hmm.
It's almost intuitive kind of knowing, and to trust that.
Yeah.
And if you think something's off, then be like a dog on a bone and don't give up till you get an answer that you
Right.
trust.
Yeah,
You know?
you're being a patient advocate for your child.
Mhm.
And I spoke with another guest on a previous podcast, and that's the only way that she got help and finally got somebody to really dig into her issues. She was a patient advocate. She was relentless. And I think
Mhm.
it's not a knock on the doctors. If you
Well,
can't see it, right up front.
right. And the system is really hard. It doesn't really support doctors in
No,
doing
the
their
t-
job well. And that's a
right.
whole
They don't
nother
have the
story.
time to really dig in and look and do these
But the
deep
medical system is
dives.
so complicated now that anybody who interfaces with the medical system needs an advocate. And my own opinion is that's one of the jobs of the primary care practitioner, is to advocate for their patient to the rest of the medical system.
Okay.
The
Meaning the
hospitalists.
insurance companies, hospitals, everybody, or
Well, I personally don't like dealing with insurance companies, but as far as
I don't think
others,
anybody does.
but specialists and,
Mm.
like if somebody needs to be hospitalized, they need an advocate to make sure that everything's going correctly and stuff. That's just my opinion. And it's just because the system has gotten so complicated
Yeah.
and everybody's overworked, especially now after
Mhm.
the pandemic.
Oh,
There's a
absolutely.
real labor shortage. And but yeah, and the parents often have to start out being the advocate for their babies, and hopefully their pediatrician or family practitioner can help them with that if the child needs specialty care.
Okay.
So that's my
I get
opinion.
that. And then, the last question I'll have for you, and again, I recommend your book to pretty much anyone.
Thanks.
Seriously. But this is actually my second copy, which of this book, because I found so much value in it. I gave it to my adult daughter who suffers from anxiety. And for other moms out there, and dads, but like you said, it tends to be the moms. Um, what other advice can you give them as far as dealing with children with airway issues and anxiety and depression?
Well, yeah, that was a really good question. I've been thinking about that. And I think this gets a little metaphysical, but I think it's important to know that, that deep inner wisdom that we all have
Mm-hmm.
is, because at one point I asked myself, well, what are the characteristics of this deep inner wisdom that everybody seems to have? And it didn't seem to matter what their religious upbringing was, what their economic standing was, what culture they were raised in. Everybody I worked with had this deep inner knowing,
Mm-hmm.
and it had these kind of universal characteristics. And a lot of traditions would call it your immortal soul, or, your, there, like I said, there's lots of different names for it around the world,
Mm-hmm.
but just know that your newborn baby has that. And it's just as ageless in that newborn baby as it will be when they're an adult in
Mm-hmm.
a grown-up body, right? So treat them like that. Treat them as there's incredibly wise and deep human beings, because we all have that.
Mm-hmm.
And what's interesting is humans, we tend to respond. We try to meet the expectations that are placed on us. And I don't know if that's because we
What do
were
you mean?
I don't know if that's because we evolved as in tribal situations for hundreds of thousands of years, but just like as so what I mean, as an example, there's a saying in parenting that labeling is disabling.
Mm-hmm.
So if a kid gets a labeled ADD
Yeah.
on in their school record, at the beginning of the year, the teacher's reading through their students' school records and they see ADD, how are they going to treat that child?
Right. Right.
Right. And that child's going to try to meet the expectation of ADD.
Mm-hmm.
Right. And you see that a lot. And like we all go through the phase of stranger anxiety when we're toddlers, probably, right?
Mm-hmm. Right.
And so if parents keep saying, oh, they're just really shy, as you're going behind their leg or whatever when you meet a stranger. But
No,
I've
it's
seen
in there.
six-year-olds that kept doing that.
Mm-hmm.
And I would talk to them, mom, said, well, just don't say that in front of them,
Right.
but also it's like, what image do you hold of your child in your mind?
Okay.
Because they're going to try to meet that expectation, because
Mm-hmm.
it's the unspoken expectations that are the most powerful. And so, and I practice this with my patients. I hold this expectation in my mind that they're competent to find their healing and to live happy, productive lives. But then I kind of leave it open to what that means to them.
Mm-hmm.
So I think as a parent, you should do the same thing with your child: is hold them in your mind as being perfectly competent to grow up and live a happy, productive life, whatever that means to
Whatever
them.
that is to them.
To
Mm-hmm.
them, yeah. And that your job is to help them discover their gifts and 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 expand on their gifts and bring those gifts to the world. And but I think that expectation, or that that image you hold of your child in your mind, even if you never say a word about it, is really important.
And it's powerful.
Yeah.
It's
and
absolutely powerful.
and that's actually a part of, like, for example, Waldorf teacher training.
Mm-hmm.
They try to teach the Waldorf teachers to hold a certain kind of expectation for each child in their class. And every morning the teacher's supposed to think about each child before the day starts,
Hmm.
in that way. And you never have to say a word, and they will do their darndest to meet those expectations.
That's amazing. Absolutely amazing. Well, on that note, I would like to thank you so much for taking time to speak with me today and to being, at being a part of our foundation and bringing your wisdom to what we're trying to do to help all these kids. I truly appreciate it.
Well, thank you. I appreciate what you're doing, and it's going to help a lot of children once this really gets up and going. It's a great
I hope
vision.
so. I absolutely hope so. Thank you so much.
You're welcome.